Hi, I'm Dr. Christine Peters. I'm an obstetrician and gynecologist at Markham Stouffville Hospital, just north of Toronto. I've had the privilege of being involved with many births at Markham Stouffville, over 7,000 as a matter of fact, over the last 30 years. So as your prenatal care provider, it's really important that we give you lots of information so that you can make informed decisions about all aspects of your pregnancy and be involved in that decision-making process. One of the things that is important for you to know about is about umbilical cord blood banking. We want to make sure that all of our patients or clients are aware of this option so that down the road you don't have any regrets. We're not telling you to do it or not to do it, but just to get the information, look at your own personal circumstance, and so you can make an informed decision as to whether this is something that's important for you. When the umbilical cord is clamped and cut after the baby's birth, the blood that's left in the umbilical cord and the placenta is called the cord blood. Basically, hematopoietic or blood cells that have the potential to become any cells in the body. They're like master cells, if you will. There have been over 40,000 transplants worldwide to date. Back in 2012, there were only 33 known conditions that this could be used for, and now we realize over 80 different conditions can be treated with stem cells. Things like cancers, blood conditions, certain genetic abnormalities, and down the road, the future possibilities are really endless. There's all kinds of research that's going on right now, looking at things like cerebral palsy, autism, things that are big worries for us as young families, type 1 diabetes, arthritis, Alzheimer's, Parkinson's, the list goes on and on. Collection process is really easy and seamless. We want to do nothing to detract from the initial experience that mom and her partner are having with the birth of their baby. It really is a miracle, and we don't want anything to detract from that. Once the mom and baby are together, with usually the baby right up on the mom's chest, without mom or baby or husband even being aware, we go ahead and just take a sample of the cord blood. It usually just takes a few minutes for us to do and doesn't interfere at all with the bonding process. You really have three options. The first option is that you collect the blood for yourself or for use of your family. That gives you complete control over what you do with that blood, whether it's for your child, a sibling of the child, another family member. You are in control of what happens to that sample. The second option really is that you choose to donate the sample to a registered bank. You as a couple would relinquish right to the sample, but the good thing is that there's the potential that that could be used by someone at some point for some condition. The third option that is that it's just discarded as medical waste, and there's no benefit to anyone in that situation. When you're choosing a cord blood bank, there are a few things that are really important for you to look at. First, you want to make sure that they have got the highest level of accreditation possible. Second, you want to make sure that you know the company has experience with releasing samples. So if you need it, it can be released efficiently and you'll be able to get that sample quickly. The third thing is you want to have an opportunity to see what their storage facility is like. Whether they have a virtual tour, so you can see how these cells are stored and learn about the process. We know in Canada, there are over 1,000 people per week looking for a match for a stem cell transplant. Given our diverse ethnic backgrounds, this makes finding a perfect HLA match very, very difficult. And the probability of finding a perfect match could be from 1 in a few hundred to 1 in infinity. If you have your own stem cells, this removes one of the barriers.